What types of educational resources regarding PrEP screening, prescription, and management are currently available for clinicians? And what are the greatest needs in preparing healthcare providers to discuss PrEP with patients and to decide when a particular patient is a good candidate for PrEP?
PrEP, or pre-exposure prophylaxis, has been recently approved by the Food and Drug Administration 2 years ago, and based on clinical trials that showed efficacy, high efficacy, if individuals take the drug on a daily basis. So there are a number of educational materials available for clinicians, which I strongly recommend any clinician who is thinking of prescribing PrEP to an HIV-negative, high-risk individual. Seek these educational materials, read them, and understand the various aspects of use of PrEP. The best material I find is available at the Centers for Disease Control website for HIV, but there are other sources. I would also recommend reading the Gilead, which makes Truvada, which is the only drug approved for PrEP. I would also recommend looking at AIDS.gov. All of these are websites, the materials readily available and easy to peruse and to understand the various concepts. What clinicians need to understand when talking to patients is that these drugs do work very effectively when the individual takes them. So the most important concept to get across to your patient is that they need to be ready to take the drug every single day. If they don't, and they engage in high-risk activity, they run the risk of getting infected, and then they'll say, well, what good was taking that medication because I still ended up getting infected? So they must take it every day. They must counsel them about still safe sex and other means to avoiding getting infected with HIV. Most important fact to remember, PrEP should never be prescribed to someone without an HIV test done beforehand, and you are sure the patient is HIV negative. It is to prevent HIV acquisition.